my name is Kat, this is Agnieszka. I am a dentist and a nutritionist. I work at the Sanford Clinic and I would like to give you some tips how to keep your mouth going, how to keep healthy teeth and healthy gums, and what to do to prepare yourself before surgical procedures if there is extensive treatment, to get the best chance to do it successfully. And Agnieszka will support me in this.
Yes, thank you, Kat. Hi, I'm Agnieszka. I'm a registered nutritional therapist and a naturopath at Guardian of Natural Health. And together with Kat, I would like to give you some ideas and let you think a little bit how you can improve your diet and your lifestyle and assess your nutritional status in order to prevent development of any illnesses and diseases that can potentially be linked to either oral health or systemic health, and how we can optimize those nutritional deficiencies in order to support the body's self-healing mechanisms.
So what are the tips worth knowing? I'm sure that everybody is very curious. What shall I do for myself to stay healthy and strong, to keep my teeth for the rest of my life? Obviously, one of the most important things that you can do is to realize that the health is in your hands. You go to the dentist every 6 months, once a year. So this is quite rare actually, because on the daily basis you need to know what to do. So when you wake up in the morning, it is worth to consider yourself to be in acidic state. Your mouth is acidic, you didn't eat for the whole night. So maybe it would be worth to dilute saliva and drink a little bit of warm water to start with. Then if you eat your breakfast, obviously you need to brush your teeth afterwards. We have to brush teeth twice a day. Morning and evening is the best, 2 minutes. I recommend flossing. I also recommend to use mouthwash, but not after brushing. I would have it in my handbag, and then if at work there is no time after lunch to brush and clean your teeth, you can use the mouthwash. I would enhance that it is not good to use alcoholic mouthwashes because it disturbs the biofilm, the flora in your mouth. So make sure that you know what type of mouthwash you use. There are mouthwashes that they contain probiotics. So for example, there is a mouthwash that contains, it's a powder that you mix with water, and for example you could use it in the morning. Also, you could swallow it, right?
Yes, I think that's really actually interesting because it's a very good probiotic-based mouthwash. But when you don't suffer from any gum diseases or any problems in your mouth, then of course you can also swallow that, and that will help restore the microbiome in your gut as well.
Exactly. Yeah. It is important to control amount of food that you're consuming through the day, because every occasion of eating there is acid attack on your teeth. Yeah. So you need to realize that eating, snacking all the way long, it's not a good idea. We suggest 4 times a day.
You're absolutely right. Eating 4 times a day is every 4 hours potentially. It depends obviously if you may suffer from a diabetic health problems, then that you may need to consult your doctor, your practitioner. This is no means any sort of medical advice that we are giving. These are just simple tips as nutritionists, as a dentist, that we would like to advise you how you can support your body. But eating potentially, as if you don't have health issues, every 4 hours is probably good enough for us to maintain this acidity level in our body, and also to stimulate the digestive enzymes. Because snacking in between the meals actually brings up also your blood sugar levels up, and what that causes is the acid, that it dissolves the enamel of your tooth. But also that disturbance of blood sugar levels can then lead to metabolic syndromes and some sort of metabolic issues. So I think, that's one of the sort of lifestyle pieces of advice that I would give people to avoid snacking. But I think diet is very key. we talk about sugar, we talk about blood sugar levels, but what spikes the blood sugar? When we're lacking proteins in our meal, and proteins help us balance the blood sugar level, and proteins also help the repair and regeneration. So I'm sure you would recommend to your patients who come for surgical treatments to have diet rich in proteins.
Absolutely.
Right?
Proteins and antioxidants.
And antioxidants, yes. Antioxidants are in many fruit and vegetables, especially those red berries.
Leafy greens.
Yes, leafy greens. And why they are important is because a lot of free radicals that are being created from foods, from the environment, or due to chronic stress, they need to be neutralized. And how they are neutralized is by having a diet which is rich in antioxidants.
Talking about fruits, I would like to mention that if you eat acidic fruits, lemons, for example, you shouldn't rush to the bathroom and brush your teeth.
Yes.
Because you're gonna take away the enamel from your teeth. So any acidic fruits makes enamel softer, more dissolvable. So we should not straight away after eating foods brush the teeth. We should wait around 15 to 30 minutes and wait for the saliva to neutralize this environment and then clean your teeth.
Would you recommend maybe rinsing your mouth with water?
You can rinse the mouth with water, but on the other hand, we should not drink straight after eating foods because we dilute the stomach juice.
Yes, I think when it comes to eating habits, I mean, it's really important to focus on chewing your food very well. Not only because there are certain enzymes already in our saliva that help dissolve the food, because digestion already starts in the mouth, and then the food travels all the way through the digestive tract into our gut. But chewing food very well, I think they say 20 times. 20 times. I know that sounds a lot, but actually we don't sometimes even realize that when we chew food, we might have already gone through 10, 15 chews. So I think, yes, that is really paramount to the healthy gums.
So also keeping your teeth healthy, because if you lose one tooth, some patients say it doesn't matter, I have some left. But actually it does matter, it disturbs the balance in your mouth. So imagine if there is a table with 4 legs and you take one leg away, what happens? The balance is disturbed. In the science, and we know more and more about it, losing even one tooth matters. And obviously we have techniques with dental implants, for example, that allow us to follow this amazing idea of having the root and the crown, and there are different materials that the implant can be made of. So making sure that obviously it's a metal in your mouth, in your body, you need to go for top quality. And there are stories about people just packing the bag, traveling somewhere, they give their health to somebody that they don't even know, they don't have established relationship.
Yes.
I think you need to make sure that you know what comes to your mouth, to your body. So in our surgery, for example, we use plasma from your blood. We grind the teeth to allow to follow this naturalistic protocol that we use products that come from your body, that your body won't throw this autoimmune reaction. So these days the techniques are amazing, and I absolutely want to pay your attention to details. Make sure what is done and what materials you choose. These days having a metal-free mouth is possible. Any metal in your mouth is like a battery in water. Corrosion, so it all matters, it is all in your hand. But going back to the health tips.
Yeah, I think we touched a little bit on proteins, but I would like to add some other macronutrients and micronutrients into the mix, because when we have a diet which is poor in fiber, and where we get fiber from, it's fiber we get from the skin of vegetables. So if we stop peeling potatoes and carrots and parsnips, and we basically wash them properly and eat them with the skin, the same apples, fiber is really important because that actually feeds the microbiome. Fiber feeds the good bacteria in our gut. Again, very important for our overall health, because this keeps our microbiome in check. And a good microbiome means, balanced microbiome means we can maintain a good level of inflammation and actually reduce the inflammation in the body. So let's don't forget about eating food rich in fiber. But going back to minerals and vitamins, you mentioned some surgical treatments, Kat. I mean, what are the key nutrients that you notice deficiencies of when patients coming to you lose their teeth?
So yes, thank you for bringing it up. It is so important to make sure that our terrain, the body, will respond to the treatment that we apply. So sometimes it costs quite a bit of money to have teeth restored when you have to have dental implants. And what happens if they fail? It might cause even more damage because then the bone is obviously impaired. So make sure that your body responds to the best way when you're ready for this extensive treatment. Vitamin D levels, cholesterol, sugar, have a blood test, or if you have any problems, contact somebody professional, your GP, naturopath, and explain that you're going through this journey. How can they support you? Lifestyle, diet, it is so important. But also I want to mention that how often I can hear this story, now it comes to my mind, there is an infection and then patients come in asking for prescription, they want just antibiotic. They don't realize that this infection sits around the tooth. Only the treatment of the tooth will stop this root cause, the initial inflammation, because obviously antibiotics control the bacterial growth, but later it will come back. So you can not have antibiotics used all the time because your microbiome in the mouth, in the gut will be compromised, and it opens the gate to, for example, thrush.
Yes, and you mentioned vitamin D. I think it's important to know that, well, first of all, we can test for vitamin D levels very simply, and I think we can do it in the clinic, right? But vitamin D levels are very important, not only just to support the immune system, because it's not only because of the bacteria and viruses, however, it's also important because it helps absorb calcium from food. Right? Why calcium is important? Because it's a major component
and bones.
of bones and teeth, indeed. So we can, of course, eat calcium-rich foods, and this could be dairy if we're not sensitive to dairy, but also we get a lot of calcium from leafy greens. Yes, kale, spinach, rucola. So let's don't forget that is an important mineral, and it's best absorbed with the appropriate vitamin D levels.
I would also say, in the end, there is so many things we can discuss today that there are tests, like we can test microbiome, we can then realize that there is this red pathogenic complex, and then you need specific treatment. So please do get in touch if there are any problems, and then watch the space, because we will be open to discussions. We will invite you to come and have some chats or maybe checkups with us if you feel that you would like to have more information. Stay in touch and watch the space.
Stay in touch, and when we do an open day, we can help you identify what's your nutritional status, and if there are any specific deficiencies, any nutrients, vitamins, minerals that you may need support with from the diet or supplementary, and provide you the right advice and help you with protecting and preventing from any sort of diseases occurring later on.
Stay healthy. Work on one thing at a time, and remember that we would like to help in any case of problems related to the teeth, nutrition. So in a case of a doubt, just get in touch.
Thank you.
Thank you.